Hello everyone, this is Dr. Mugahid again. Don't forget to subscribe to our channel to get the new videos. Today we are going to talk about facial pulsing. The one you know, the facial nerve is important for facial expression. We need the facial expression. We need to do a lot of expressions in our life. Okay, we need to be smiling sometimes, although we don't see a lot of smile nowadays in our country. Sometimes you need to be angry when you see a bad thing happening, like this guy. Sometimes you need to be just what we call it mask face appearance, no expression at all. Sometimes you need to be sad when you hear something which is not good. Okay, unfortunately we hear a lot of things which are not good nowadays. So today we are going to talk about facial pulsing. What do you mean by facial pulsing? When someone comes to you with an asymmetrical mouth, he can close his eye in one side, he cannot close his eye in the other side. So we have to understand what are the basics of the facial nerve and what are the causes of facial pulsing. Okay, loss of facial expression. Also, we should remember that we hear a lot of terminology in the medical school, what they call it crocodile tears. This is also related to the anatomy and the pathology and the pathophysiology of facial nerve lesions. So we need to understand all of this today. So remember, the facial nerve is a nerve which arises from the pons to medullary junction. This is the pons, this is the medulla. And from this area it has got important nuclei which mediate important functions. We have the motor nucleus of the facial nerve, and this will give us special visceral efferents function, which is the supply of the muscles of facial expression. This is located in the pons. We have the nucleus solitarius, pontine nucleus solitarius of the facial nerve. This will mediate special visceral afferent, that is to say, taste sensation from the tongue, anterior two-thirds of the tongue. We have the general visceral efferent function from the salivatory nucleus, superior salivatory nucleus of the facial nerve, which is a production of which provides us with secretions, nasopharyngeal secretions, salivation, and lacrimations. Okay, lacrimation from the eye and mouth, some of the mouth secretions, and also we have other functions of the facial nerve. For example, general somatic afferents, sensory from the ear, from the external canal of the ear, through the spinal trigeminal nucleus. Okay, so basically you have to remind yourself what are the important nuclei which are located here that give the commands to the facial nerve. The facial nerve will arise together with the nervus intermedius, and then they will enter internal acoustic canal in the ear, will go medial laterally and here there is an important ganglion at the end of the course of the facial nerve here called the geniculate ganglion, which contain the unipolar cells which receive the sensory inputs from the taste sensation of the tongue, and then it curves posteriorly, and then it curves down to get out through the stylomastoid foramen. So the facial nerve passes through two foramina within the skull, acoustic meatus and the stylomastoid foramen. It will get out, then it will give some motor branches before it enters the parotid gland, and then within the parotid gland it will give us the 5 terminal branches which supply the muscles of facial expression. There are multiple branches, of course, you know them: temporal, zygomatic, buccal, mandibular, and cervical. Now, before they give these branches, there are some intracranial branches. For example, an important nerve called the greater petrosal nerve. This is important for supplementation of the lacrimal glands, for secretions of the eye, and also for some of the nasopharyngeal glands innervation, and for the salivations in the mouth. There is an important other nerve which is the chorda tympani, and this will give us the taste sensation from to the two-thirds of the tongue, and the salivation of the mouth. Okay, so it's a mandibular salivary gland. It is here from the chorda tympani. There is another important intracranial nerve which is the nerve to stapedius, which you go to stapedius muscle, which is an important function of reducing the intensity of the sound. Okay, the damping action. Other branches, as we said, are mainly motor. So this is just an idea about the nuclei of the facial nerve, the origin of the nerve, and the important branches of the facial nerve. What about the lesions? What can cause lesion facial nerve? Either the lesions comes from the upper cortex, the upper fiber, supranuclear fibers, which will supply the nuclei of the facial nerve. This will be called upper motor neuron lesion. For example, tumors here, or stroke, or any lesion in the upper part. Or the lesions might be at the area of the pontomedullary junction. For example, cerebellopontine angle tumors or stroke. The lesion might be in the peripheral nerve itself, the peripheral neuropathy, Guillain-Barré, and so on. Or the lesion, or idiopathic facial palsy. The lesion might be in the red ganglion, for example, Ramsey-Hunt syndrome, which is a viral infection. The lesion might be due to problems in the ear, middle ear infections, or chronic otitis media. The lesion might be due to parotid tumors, invasive parotid tumors, or parotid surgery. So if you follow the course of the facial nerve, you will have an idea about the possible sites of lesions of the facial nerves. So always try, you should not forget that in upper motor neuron facial palsy, upper part of the face is normal. The patient can close his eyes. If you ask him to close his eyes, he will close the eyes normally, but the mouth will be deviated, and then you know that this is an upper motor neuron facial palsy, and always the mouth deviate to the normal side. In lower motor neuron facial palsy, if you ask a patient to close the eyes, he will close one eye, but the affected side eye will be open, and again there will be flattening of the nasolabial fold and mouth deviation again to the normal side. Okay, so you know this is a lower motor neuron facial palsy. Okay, so you have to be able to differentiate between upper motor neuron and lower motor neuron facial palsy. Some diseases give us bilateral facial palsy. For example, Lyme disease, infection caused by tick, it is tick-borne illness. For example, Guillain-Barré syndrome. For example, bilateral stroke. This condition, they can give us bilateral facial palsy. What are the important connections of the facial nerve? Facial nerve should have connection with other nerves. One of the important nerves, trigeminal nerve, which gives us important reflexes. You know the corneal reflex. This is the afferents come from trigeminal nerve, the efferent through the motor nucleus of the facial nerve. Suckling reflex and rooting reflex, the afferents from the mandibular part, trigeminal nerve, and the efferent also through the motor nucleus of the facial nerve. Connection with the optic nerve. If you flash a light to the eyes of the patient, he will blink. This will give us blinking reflex. So optic nerve fibers, they will relay in the superior colliculus, which will give signals to the facial nerve. Connection with the cochlear nerve. If you make a big noise to someone, he will also blink his eyes during this, or he may turn toward this side. So this the acoustic reflex, this is also important. Okay, you need connection between the cochlear nerve and the facial nerve, and there is an important connection between the emotional part, the emotional nucleus, which is part of the limbic system, called nucleus accumbens, and the facial nerve. That's why patients with problems in this system or in this nucleus, for example, Parkinson's disease patients, they don't have any facial expression because of lesions or affection of this nucleus. Okay, so you have to remember this. So finally, what is the idea of crocodile tears? If you go to our previous diagram here, so during injury, after injury, during regeneration, sometimes mixture of fibers occur. So the signals which were meant to go to the mouth to induce salivation in case of a foot. If you give someone a foot, something to eat, you should induce salivation. These signals, they will go to the opposite side. They will go to the eye during regeneration. They will go to the greater petrosal nerve fibers. They will intermix together, and then they will give us lacrimation instead of salivation. This is just the simplest way to explain crocodile tears. Okay, thank you very much.